It's lovely to have you here, Boris.
Thank you.
Ladies and gentlemen, I just want to tell everyone, I have a beautiful guest on today, a legend, a lecturer, an intelligent man.
Way too much cred.
Everything you need to know. This man is a very dear friend of mine and a great, experience being friends with him and spending time and quality and stuff like that. Boris, everyone, I welcome you, Boris Lukin.
Hi, Boris Lukin. Happy to be here.
Yes, it's an honour to have you here. It's taken us a while.
It's taken us a while. Boris, you've been on our mind for our first guest for ages.
For a long time.
I can't believe it's taken 4 epiethes for me to get on.
Well, we're saving the best for the first. We're doing it a bit differently.
100%. First is always like the breakthrough, the play, and
get the audience to introduce.
When the legend comes on, everyone needs to be prepared. You are the legend in our community and around the world.
Like I said, around the world.
Boris is international now.
International superstar,
Boris
man.
international.
I'm telling you, you're a superstar in a lot of people's eyes. I'm telling you.
So, Boris,
I definitely appreciate it.
Sorry, I cut you off. We've known you for a while. How about you introduce yourself to the audience and get them to have the pleasure of knowing you as well?
So, basically, I'm an osteopath. Work in Community Ponds, run my own little clinic. Also work at a university. And so, basically, just teaching the next generation of osteopaths out there. And also do a fair bit of Air Force Reserves. So that sort of keeps me quite busy.
Crazy schedule, man. Crazy schedule. I've noticed, man, like nowadays people can't run a 9 to 5 by themselves, and you're doing 3 things that would all be a career in themselves. Like, being a business owner, being a lecturer, and being How do you manage such a crazy workload, man?
It's a good question. Sometimes I ask myself exactly the same question. I guess most of the time it's just being super organized in terms of making sure that your schedule's on track, making sure that you are looking after your health, most importantly as well, and just loving what you do. I think ultimately, if you love what you do, then everything you do isn't actually hard work at all.
Yeah, of course. Be the best version of yourself and you'll enjoy every day.
Absolutely.
Some Boris wisdom there for the audience. We're starting off strong.
Actually, I reckon that you came up with that.
Did I?
Yeah.
Oh, I don't know.
Frankie, I think you understand. You got a lot of philosophy and experience in life, I'm telling you.
Thank you.
You're like a master.
I'm like if Boris is Yoda, who am I? Luke Skywalker then?
Nah, there's no way. No way.
Obi-Wan, I'll take it.
Obi-Wan.
Guys, I'm going to crack the water, start off with that first, and then we'll work our way into it.
Don't tell me you're nervous.
Never, Boris. I live for this.
Let's see.
But it's definitely an honour to have you on, Boris. I'm telling you, for the people out there, he treats me for injuries sometimes that occur through training, and a lot of knowledge that comes from you and that I've learned over the years. So I do appreciate you.
I guess most of that really comes from just general conversation that we have some really intellectual conversations that just span philosophy, span time and space. Really.
Yeah.
we do go in deep, don't we?
And I feel like sometimes that's the most important thing is to have these conversations with people. People don't have them anymore.
Yeah. That's like another thing. People don't communicate, and people don't have I'm not trying to put pressure on you, but role models. Someone older than them that has lived a million years longer than them in terms of experiences that doesn't share it anymore. I think
a lot of the time though is that it needs to be like a two-way conversation. So you need to also listen to what the person's saying, so you can pick up where they want to come from, what they're doing, what their thoughts are, and then from there, you kind of just sort of bridge those gaps and have those honest conversations where you get to both learn. Because equally, I've probably learned heaps from both of you, actually, in the conversations that
Boris.
we've had.
Oh, you, man.
No. I feel like we come from a different world, like a different realm for some reason. That's what I feel like.
You guys definitely make me think a lot of stuff, as in make me not question, but almost question my thoughts to see if it is relevant.
Wow.
So just as equally like you say, you respect, I guess, myself for bringing out all that wisdom and stuff. I equally learn a fair bit from you guys.
Oh, very
you guys absolutely approach a topic and a conversation from a completely different perspective that sometimes I don't even consider.
Yeah.
So as a result, it's kind of like, wow, this is actually broadening my perspective and my views. And so I guess, like you were saying, you really do need to maintain the art of like conversation, but you also got to listen to what people are telling you.
Yeah.
Boris, do you feel like over time people's communication skills have gone down? Like from what you remember when you were probably a bit younger than we are now, or whatever, like the dynamic of like social relationships have changed?
Yeah, 100%. I think most of the dynamics have completely changed. Like with the internet, social media, everyone's sort of more online texting. They don't really understand the art of communication, right? Like,
that's right.
It's not really just about what you're saying. It's not just the plain text. It's really just the smiles, the tone in the voice, the pauses, also like the body language. That's really important. And I think as humans, we really need that connection more so than just arbitrarily having a conversation over text or email
definitely.
or social media.
Because it's like it's easier to text, hey, how are you, than picking up the phone and say, hey, how are you?
Yeah.
But it's better to call, or even better to go see him, you know, physical. Sometimes me and Frankie will call each other and say, hey, come over for tea.
Yeah.
It's better than texting, hey, how
even
are you?
that. No one does that even anymore.
Yeah.
No one goes over to their house and has tea or has coffees or.
We were talking about it the other day, and we're like, after the pandemic, when it came to social interactions, there'd be like a form of anxiety now. Like, do you like know what we mean with that? Like, people get like, it's awkward now.
It
It's
is.
anxious
You're
at
saying
times.
something
you know?
like this. Yeah, you're right.
No, 100%. Like I see this mostly with younger students that I teach. And so basically they don't communicate amongst themselves. I can walk in. So I don't know about you guys, but when I was at university, the whole class was rowdy as. Like you'd have 30, 40 students in there. You'd be having a conversation. He's trying to pick her up. She's like denying him. They're all having a conversation about what happened on the weekend, what their thoughts are about life or whatever. Now I walk into a classroom and everyone's quiet.
Just on their laptops.
Just on their phones, on their laptops. No one's even like communicating in amongst each other. And just recently I went into a class and I was like, man, why are you guys so quiet? And they were like, I don't know. They wouldn't even talk to me. And I was like, why don't you guys just talk to the person next to you? Just say, hey, my name is Boris and what's your name? They don't even know each other and they've been at university for 2 years.
Yeah. Boris, I wanted to ask you, man. So obviously, like I just a bit about like your career progression. So did you start off first as a business owner or as a lecturer, or like how did you end up in the position you are today, career-wise?
Mostly just a business owner first up, and then I just sort of. So I started my own business while I was at university.
Oh, wow.
So I started off with human movement, then I transitioned to osteopathy. So within that time frame, I was doing personal training, and then I decided to open up my own business. Ran that for quite a number of years, and then decided in my last year of University of Osteopathy, I'd open up a proper clinic with rehab spaces and gym spaces and so on. And that sort of just evolved into what it is today.
What's the company name?
So it's Beyond Fitness.
Yep.
It is the company name.
So if anyone needs, if anyone needs all the fixes to the body, and if you want to explain a little bit what that.
Yeah, so basically all I really do is osteopathy treatments.
Yep.
And so basically osteopathy is a holistic approach where we do a lot of hands-on manual therapy for people's aches and pains and musculoskeletal conditions.
Yep.
And I guess a lot of it isn't necessarily just musculoskeletal. Like, you know how we're talking about communication and the art of communication? I think part of that is really building up a good relationship and a rapport, like with you guys, and having those conversations that actually assist patients in better recovery. Because a lot of the time, people don't realize that it's not just, well, it is physical, but you also need that mental side of things, that you got to reduce your stress levels, you got to fix up your thought processes. It's not always like a link. It's not always like a logical link. There's a lot of grey area in what we do.
I was thinking about it, and I'm like, someone might be talented at it and like at a profession or something, but not everyone can take that profession to the next level and be a business owner. Some people just aren't cut out for it. What do you think makes someone a business owner? Because you're talking about that connection and the link that not some days you're going to have it, some days you're not. Like, what gives you, off the top of your head, I know it's a bit of a tricky question,
That
but
is a tricky question.
what makes you so good at what you do?
I don't know. People say, oh, you want to be an entrepreneur and you want to like set up your own business or whatever. I think I just sort of naturally transitioned into it because I was seeing a lot of people doing, let's say, personal training, doing osteopathy, and I was like, man, I could do that so much better. And I think it's just that drive to be better and being able to offer someone a service that is not linked to anyone else's philosophy or the way they do things, you know?
It's your own way.
It's my own way. It's like, and that's probably why I struggle to get other staff members on board, like let's say admin staff and so on, is because I want stuff done my way. I don't actually want them to do it their way. And then that's really hard to coach some people. People actually don't want to do it.
And yeah, I've got to say, Boris does his own office, like administration work. He books his clients himself.
Yeah.
You honestly do have a crazy
One-man
schedule,
army.
man.
Yeah.
Like,
because I've always had that question in my mind. I was like, why doesn't Boris expand? And then I realised now that it's because you run at a certain level and you don't want to go below that level.
Yeah,
which is very interesting.
But it's also, and you probably appreciate this, right? Is like, if you want to book in a time with me, you text me, you go, hey man, I'm sore, when can I see you?
Yes.
And then we have that relationship.
Correct.
And I think for a good outcome, it's really important because we do have that relationship. We can be open and frank with the discussion and how we manage that accordingly. Whereas I think when you go to those big kind of clinics where you've got admin staff, you got practice managers, you lose that personal touch. And then when you lose that personal touch, it doesn't become as therapeutic, if you know what I mean. Like you can't sort of dive in and have those great conversations or spend a bit of extra time with your patients.
That's right.
And it's always like on the clock, someone's knocking on your door, get out, next patient's in. So you definitely lose a lot of that.
Because I feel like what's kept me coming back to you is definitely the relationship we have. It's like a friendship, where I text you, Boris, I need time in tomorrow. Yep, done, come at this time. And, sometimes you even, whether you give me extra 15 or 20 or 30 minutes, that's quality time, and you're always taking care of me with everything. And that's what keeps the relationship going, I'm pretty sure.
Yeah, no.
Do you both said something very interesting. You said the relationship is important, like to keep it proper because it's therapeutic. And he highlighted how important the relationship is. Yes. And I think a lot of that kind of gets lost in like consumerism and like corporatism. Like, do you know what I mean? Yeah. In that whole business infrastructure, people forget the human approach to things and like the human connection. So it's an interesting point. Like,
well, you can't treat a human or a person like a production line, right?
Yeah, exactly.
It is that human interaction and human touch. It's not like you're moving a product from one space to another. You're not.
Yeah. Everyone's there for a reason.
So, correct.
Yeah. Very interesting. Boris, I've got a question. What is the difference? Everyone asks this question.
Here we go. I have a feeling I know where this is.
What is the difference between a physio and osteo and what you do?
All right. So this is how I answer that question when anybody asks me. So we treat a different way. It's basically the philosophy that we treat by, but ultimately it's really the consistent end result. And always the end result should be and is generally a good outcome, like pain-free movement, better body alignment and whatever the goal is. So that's always the consistent goal. How we get to that goal is a different way. So let's say physio, currently through the evolution of physiotherapy, they actually do a lot more exercise rehab. They identify the dysfunctions and the restrictions, and then they provide exercise for it. Where osteopathy is a little bit different, and excuse me if those physios out there that treat differently, because everyone's a little bit different. But I don't want to cause any riots between physio and osteopathy.
No.
Stage.
No beef, just Boris.
No beef. Yeah, come talk to me. We'll hash it out. So where osteopathy is sort of a bit different is we probably use hands-on approach and more manual therapy as the vehicle to get to that end result, right? Yeah. So we still provide exercise. We'll still give you, hey, do those stretches, do that homework. Not that everyone does it, but we try and create that and build that rapport with that physical touch. And I think physical touch is really important in maybe today's society where everything's so removed and no one's like face to face. No one's, touch is almost a dirty word. You can't touch anybody, all that sort of stuff. Ask for consent and everything. So I think just having that physical touch, respectful and be therapeutic is actually very beneficial. And there's some fair bit of evidence around why does manual therapy work? And there is a lot of evidence out there that does indicate that it's really just the physical touch aspect of it. So whether you move a joint a certain way or push a muscle a certain way, that's all great. And the patient might go, oh yeah, you're really hitting the spot, that's tender and whatever. And you might be doing the therapy to ease that tension. But it's really the end result is it's a physical touch that actually gets the best results out there.
Boris, can I ask you a random question? Do you know at all shopping centres you'll see like a Thai or a Balinese massage joint or thing? What do you reckon of them? Are they like a stay away from?
You know what? A good question. I actually recommend some patients go to those. So at an ad hoc kind of perspective, if you need like a treatment, why not? Get a bit of a rub in the shoulders, in the neck, in the lower back. If you have an actual proper pathology, then you probably might want to stay away from those and get someone who has the right skills to be able to assess that condition.
Like an injury.
Yeah, like an injury, and then also then be able to apply the right amount of force and treatment for that particular injury. But if you just got stiff muscle, why not?
Yeah.
It's not a lot of training to do that component of a treatment. Where the training really comes into play as a therapist is really in the knowledge that you have about those conditions, about the human body, about the therapeutic effects of certain techniques. That's where all that comes into play.
So what's your favorite part of the job? Is it the social interactions? Is it healing people?
Hit the nail right on the head. That's literally it. So it gets a little bit boring after a while, like, you know, just doing the same old rubbing and cracking techniques, sticking those dry needles in and all that. But where the joy for the job really comes in and keeps you going back is the social interaction, like getting to know people, knowing where they come from. And look, let's face it, like you guys have interesting stories, but then I've got a lot of patients with, sorry guys, even more interesting stories where they're literally...
You were being betrayed.
Yeah.
We've got to step it up.
We've got to organise a meetup.
I gotta be honest.
A conference of ideas, you know, everyone's just hashing out all their ideas and their thoughts with each other. Boris in the middle.
I think we've got to step it up a little notch, Frankie.
Yeah.
Well, you know, these patients do come from a fairly challenged, adverse backgrounds, and they've sort of achieved certain things that most people struggle to, even from a more privileged perspective. And so I absolutely respect that. And that, I think, like we were sort of saying, is like I probably get more out of those sorts of patients when they tell me their stories as opposed to what I feel I provide them. Yeah, you do the physical kind of manipulation, you give them some good advice for the treatments that, or the conditions that they've got going on. But I think for me personally, it's really the, I guess the fulfillment of seeing people succeed and overcoming those challenges.
So would you say you're also like a therapist at the same time?
Nah,
Come on, man.
Honestly, when I need advice, I get a Boris.
It's kind of like a hairdresser, right? I've heard it all. I've seen it all. Well, I probably haven't seen it all, actually. I think you guys have got some pretty good stories.
No comment.
We've got some interesting stuff.
We have some
But you got some interesting stuff as well, Boris.
Oh, well, and this is the thing, right? This is what keeps me engaged in doing this job, is because I get to see all those interesting stories, and I do like stories, right? I've always had this philosophy, is that in life you can achieve a lot of things, but the only thing that you can't sort of lose is stories, right? So you really want to be able to have those really great stories, so you can relay those stories, I guess, to other people or your kids or...
That one hit me on the head.
Yeah, that was very powerful, Boris.
Very interesting.
Really interesting.
Yeah.
Wow,
powerful,
got
yeah.
heaps.
This is what I mean. Boris has got wisdom. Boris has got
come on,
wisdom.
Boris is king.
Nah.
But see, do you know the thing, we were talking about it before, like that these conversations that you said, like, you know, like people don't have these type of conversations anymore where people just share wisdom, like, and share a perspective, you know, it's not common, you know.
Nah, not at all. But, you know, back in the day, what would you do at night? You would sit around a campfire, you'd talk to the elders, that, you know,
Have a
put you
cup
to
of tea.
bed, have a cup of tea,
do something.
you know, cook up an animal that you've just caught, have some dinner.
So Boris, you're Croatian,
Yeah,
obviously. So you're Balkan. So did you grow up in like a very strict like ethnic household, or?
Nah. See, my parents migrated here when I was really young, so no.
No.
No, not that
So were you
strict.
born in Croatia or were you born in
No,
Australia?
I was born over there. So
Oh, well,
I
I'd love
came
to
here
go to
when I was
Croatia.
7.
Do you know
Should.
how nice it looks? It
It's
looks
amazing.
great. Boris, boys trip, Croatia. Let's go. I
man.
would full go to Croatia.
I don't know if
Boris,
you can
man.
handle it. I don't know if you can handle it.
That's pretty interesting. Boris, question.
Go.
What's another question? How much is it? So if I have an injury and I come to you and say, "Oh, Boris, my shoulder's hurting," how much of it is physical and how much of it is mental?
Well, look, I guess it depends on the type of injury. So if you've literally caused yourself a physical injury, probably about 90% of that would be inflammation and actual injury to some of the tissues that surround that shoulder and what have you. So that's probably 90%, right? And 10% is maybe more the mental, how you feel about the pain and so on. So nociceptive pain, very much inflammatory driven, very much damage to the tissues, right? Whereas if you've got like an injury or a pain such as like a headache or some of those non-specific pathological type of pain, then 10% of that would be physical, 90% of that would be absolutely mental. So I guess it's a good question. It really depends on what the condition is. It all really depends on how you want to manage it. And it depends on where the patient, how they've achieved that. So achieved it, I don't know whether getting an injury is an achievement.
But no, I get what you're saying. If you have a positive mindset to recovery, it will help your chances of recovery. If you have a negative mindset and you think, oh, my life is ruined now and this and that, it's going to take a toll. Speaking of recovery, I don't know if you can explain like certain stuff, but what is your like greatest success story, like in terms of recovery with a patient?
I'm going to say this guy.
Oh yeah, I've had a lot of injuries.
There was a lot of injuries.
A lot of injuries.
Yep.
And you kind of, you're like, this is why I call you a technician, because I'll tell you I have a pain in like my shoulder, and you'll just put your hand there and you're like, oh, it's this. And then you'll say some weird name that it's called. I was like, yeah, that's it. That's the one. And then you do a bit of treatment and then...
Yeah, Boris gives you the goss. He tells you what you've done wrong.
Yeah, and he'll look it up and, okay, you've done this, you've done that. But it's just like, I don't even know this stuff. Even if I was to go to hospital, I'll have to do all these scans and all these x-rays. 2-3 days later, then they say, oh, this is the injury you had. Boris is like just pinpoint.
Yeah,
man.
but that's only because the level of training that, let's say, osteos have is like 5 years of university. We learn all anatomy, physiology. So when you have a particular injury, depending on how it presents, whether it's sharp pain, achy pain, burning pain, or numbness and tingling, or pins and needles, you can sort of understand what tissue might have been damaged. And then from there, you can do a quick couple of tests, poke around a little bit. If you know your anatomy and know what structures are underneath your fingers, you can basically then pinpoint exactly what's happening with the...
So from what I know from like my personal experience with my body, I'm always in a constant state of pain. And I feel like, people nowadays, our postures are all terrible and, just basically, what are people doing wrong nowadays that is just like a small quick fix that if they fix, they can save themselves a lot of time and pain?
Most people would get so many better benefits if they actually just moved a lot more. Wow. So what they should be really doing is getting up, not sitting around so much, not texting on the couch, not watching, Netflix in their bed, sitting in weird positions. So I think movement is really the best medicine. And I heard this like ages ago from a patient, of course, because I listen. And the patient said, motion is lotion, rest is rust. And it holds true with most different conditions.
That's more wisdom.
So motion is definitely
Boris,
lotion.
the wisdom's flowing, man. It's flowing like lotion. I'm telling you, the wisdom, he's got it. He's got the Midas touch.
It's very interesting because you are right, because that was one of my questions is how much, sitting down a lot, how much is that affecting us, with injuries?
If you look at most of the research out there, what they're saying is if you sit 20 minutes a day, it's as if you're smoking a cigarette. So, and it drops your life expectancy. And so that was a study, I think, in now I'm making things up. I think around the 2008 or something, where the study came out. And so ever since then, there's been more studies that sort of indicate that sedentary lifestyles of not moving as much actually causes worse outcomes and reduces your life expectancy because of that. And so if you just move a little bit more, that's better. And then when you're talking a point about sitting down too much, well, that's why we have stand-up desks, right?
Wow. So I never thought of that.
You have stand-up desks? Yes, you do.
Nah, to be honest, when I'm on the computer, I get comfortable, man. I stretch my legs. Yeah. I've got like a little ottoman underneath that I put my feet up on, and I get really comfortable. Because when you're normally at the computer, so some people with their careers or studies, you're at it for an extended period. So, people that work office jobs are sitting on a desk for 8 hours a day.
Yeah, absolutely.
And that's a big problem because throughout human history, like you'd know more than this than me, but people haven't lived like that or worked like that before.
Well, the reality is that humans are lazy. Right? And I'll admit that humans are lazy. We want to try and conserve as much energy as possible. So when you sort of say stand up at work for 8 hours, you're going to be like, man, I'm going to stand up here for 8 hours. I want to be chilling with my otherman and kicking back with my vapes, just chilling, doing stuff on my computer.
Man. You're going to get comfortable.
Right? But the reality is that's literally killing you.
Yeah.
So, sorry to cut you, Frank. So would you say laziness and being comfortable is killing us inside?
Yeah, absolutely. I mean, there's a really great book out there, and it's called Death by Comfort. I don't know who wrote it, so sorry to the author. But he literally spells out all the reasons of why comfort is literally killing us, because we're not getting that activity. It's not... not conserving energy. No, it's not burning more energy. It's not raising our heart rates. It's not utilizing the body like the way it was built to be utilized, because we've built to move. So if we're not moving, then we're rusting, right?
Yeah, 100%. You're right. It's very interesting.
That's interesting. So, Boris, you've definitely got like a very extensive like knowledge of your profession. So when you were picking the Army Reserves, why didn't you pick something medicine focused? What drew you to the Air Force?
Man, that was a decision maybe of 16, 17 years ago. So basically I just wanted to do something bigger than myself. I wanted to join an organisation that would, and I'm not massively patriotic, I don't fly the Australian flag anywhere, but I wanted to do something more for what I call my country, because it's your countries as well.
Yes, 100%.
No, I agree with you. I love the idea of Army. It's something me and Ahmed always talk about. You know, we always say what if and what if, and it's really inspirational. To see someone that can do it.
I just wanted to do it because I wanted to be part of something that was bigger than just one small organisation or a big company, because this is the whole nation.
Yes.
And whether I chose the Army or Air Force, it was just really a timing thing, right?
Okay.
So they said, do you want to leave in a month or do you want to leave next week? And I was like, yeah, I'll go next week. I had a schedule to keep.
That's it,
So what's your role in the Air Force?
So I'm an FL Defence Guard, although that role is slightly changing. So it's basically just the infantry type of work, but in the Air Force context.
That's crazy,
So,
man.
yeah, we don't do all the crazy patrolling out sort of stuff or doing any of that real frontline combat stuff. We just do more security around the airbase and on aircraft. That's how I explain it.
If you don't mind me asking, have you ever been deployed overseas?
Yep. So I've been in Afghanistan 2013.
Wow.
And don't think it was that exciting. Don't think I was like out there doing massive patrols, raiding villages or what have you.
Were you shooting guns, bar? That's the big question.
I didn't even shoot around on the range.
What's that?
I know, right? It was very much a security role. But we were there to support the Allies forces in doing their role. So it was a really good gig in terms
handling,
of
packaging, stuff like that, pretty much. Like moving like ammo and stuff like that, or just more basic even than that?
No, it was even more basic than that. We basically stood at gates checking IDs and making sure that the bad guys didn't come in.
That's crazy.
To be honest, it's a bit off topic, but I've heard Afghanistan's a very beautiful country. It's all like mountains and ravines, and like I heard the geography is very nice.
Where we were, geography was very bare, but it did have a lot of mountains.
A lot of mountains. A lot of tunnels, a lot of mountains,
yeah, but I have to admit though, the most beautiful sunsets were from Afghanistan. They had like the best sunsets. So we'd be doing 12-hour shifts, start at 10, finish at 10 p.m. and you get the sunset.
12
and
hours is long.
Yeah, that's especially in that climate. It'd be like super cold and super hot.
Oh, it's definitely not bad for you.
Yeah.
Yeah, Boris is a workaholic.
Yeah, he's a work machine.
I just loved it.
Yeah.
But yeah, no, you can't beat the sunsets.
That'd be crazy.
The amazing colours, just desert sunsets. Love it.
Speaking of Afghanistan, have you travelled much?
I've been around.
That was scary, fake, man.
All right, we'll leave it at that then.
That was scary.
We'll leave it at that.
That came out so silent, but so dead at the same time.
Sorry, Boris.
No, hey, I was happy to elaborate, but
That scares me, fake.
we can leave a mystery.
We'll leave it mystery with the Boris.
Everything's a mystery in life. Being mysteries, being a mystery is good, I think, in life, to be honest.
Absolutely.
I've discussed some things with you, about certain things. Being a mystery is very interesting.
It is. It keeps people intrigued.
Yeah, 100%. People let off too much of their character straight away, and you leave nothing to be excited for about yourself, like from the opposite person. You just go out and be like, I like this, I do that, I do this, and what else is there left to know about you,
Yeah, true.
What do you think is like something that's really misunderstood about your job by a lot of people?
I think, actually, this is a really good point, actually, now that I've thought about it. I think a lot of people just think that we manipulate, we rub and crack some bones and we stick a few dry needles in or whatever. So I think most people see the physical, feel the physical, but really what not many people know about these allied health professionals is it's really about what's happening in your clinical reasoning side of things. So even though if you've done this for quite a while, and I have for maybe going on to 13 years now, you think, oh, this is just easy. You just rub and crack this and you poke that structure or whatever. But there's quite a fair bit of thought process going around it. Like in the case history, you're asking questions where you're trying to work out what's going on with that patient, trying to get those key indicators out there for putting your differential diagnosis in place to go, well, okay, if I'm asking these specific questions, you're giving me these specific answers. From that thought process, I might be going, oh, I think it's actually this is a diagnosis. Yep. And then being able to then go and test it out with doing those orthopedic tests. And then from there going, yep. And like you pointed out last time, you were like, oh, you poke here and you know exactly what's going on. Yeah, it comes to easy. And you were just like, oh, he just knows everything, right? Yeah. But in my head, I'm like, oh my God, what's going on there? Yeah. Does it feel like this? Does it feel like that? Is it sharp pain? Is it dull pain? Is it referred pain? How did it happen? How long has it been going on for? And then all those clues, again, back to the mystery of what it is. And that's another part I like about the job is the problem-solving side of things, where you're kind of like a detective trying to work out what's happening in the body, right? And what happened. And so that's probably the least understood part of the job.
Wow,
the clinical reasoning side of things.
Well, I've got to say, Boris, you're like very quick to solve the problem. So like whenever I've gone to you, you'll ask me what the questions are, you'll take your notes and you'll be like, all right, jump on the table, I'll have a feel, I'll have a suss. And then within minutes, you're like, yeah, that's it. So you do process like what you're finding very quickly. So yeah, I can see why people wouldn't assume that's
probably comes with a lot of experience. So I mean, we teach this at university, but there's a thing called like clinical reasoning, right? And there's a proper cycle of it. So you can shortcut that cycle because you have pattern recognition. So when you guys come in, I've probably seen this like 100 times before, right? So I can quickly recognize those patterns. That would give me an indicator to then just poke in a few different areas, do a few tests and go, yep, I know exactly what's happening with you. Let's do the treatment, because I've done it again 100 times to get a good outcome.
No, that's interesting. And like, look, I've got to say, with your qualifications, you have a master's, don't you? Would you ever think of doing like further education, getting like your PhD or whatever? Or?
I've thought about it.
We were
talking about this last time, right? Yeah. I've thought about it. It takes a bit of time, and you got to kind of know the right people. And really? I'm sort of saying you got to know the right people. And again, I've probably just only dived into this scope to look at what it's going to take to do a PhD. But you got to know what people are doing, what research, so you can jump on board with them to do your PhD. Because I don't want to be doing lame studies that actually don't advance the profession. I want to be engaged in studies that are actually going to make a difference to somebody. And I think that's the key. I think a lot of people do PhDs just to get a piece of paper and say, yeah, I'm a doctor now. But it doesn't mean anything, right? Yeah. What did you study? Oh, I studied how many people it takes to screw in a light bulb.
They do have some weird studies. Yeah. We were talking about this last time, some people.
I saw this thing on Joe Rogan. I saw a highlight of it recently. It was from an episode like 2 years ago. And these guys were writing like papers on sociology. And they were just shooting it and just writing all this random stuff about like political correctness and, you know, like a conformed world and stuff like that. And people were just passing it. But like no one was reading through their stuff. And it was scraping through. And some of the stuff that they were publishing in journals was like hilarious. You know, I'll send you the clip later on. It was, it's funny.
Do it.
So
I've even heard that a lot of people are actually using ChatGPT to write their papers. I'm not even kidding you. And so when they're publishing the journals, rather than editing through the journals, they still put in the details saying this is written by ChatGPT right at the end.
Because I'm studying and Boris is a lecturer, I've got to ask him, how does a lecturer know if a student's work is plagiarism, if it's not authentic?
You can absolutely tell straight away. You can just tell. Because I don't want to give away the secrets.
No, don't give the secrets, but just briefly.
Yeah, just briefly.
Because honestly, it doesn't read well. The introduction and the content is repetitive, and it never answers the question completely. And it's always... It's not deep. It's not deep and meaningful, and it usually doesn't incorporate the content that you were teaching. So when it's something like generic, you go, hang on, we taught more in depth than this, and you just spent like 7-8 weeks in the course, and you still can't write what we need. You know it's ChatGPT. Yeah. I've even had a student submit. This is so dumb. I don't know how he thought I wouldn't notice. He literally submitted a 2-page report, still in dot points from ChatGPT. So I just cut and paste, submit.
So what happens then? Does like, well, I know it's probably not your department, but does a student get expelled or something? Or
no. Like I think, so that's a good question. I just approach it as just fail them. Just give them 0.
Yeah.
And then get them a right of reply, because I usually say, you got 0 because I think you use ChatGPT, it's not your own work. And hey, happy to be corrected wrong. Please set up a meeting with me so we can discuss it and I can remark it.
Yeah.
Usually 100% of the time, they just accept the 0. They're like, move on. I'm going to move on. I'm going to lose that 30% overall.
Very interesting. Being like a lecturer and a teacher in a uni, what do you feel like is the main problem nowadays with students? Do you feel like they're putting less effort into their work? They're not studying hard enough? What's going on?
Straight away. I don't know exactly what's going on, but it's really engagement. I think students, actually, this is just more my speculation, so don't take this as like fact. This is just what I've observed, is that students don't really want to be engaged in the content, and they're just at university to get a piece of paper without doing any work. Okay. And so I was talking to another academic recently, and he was saying that university, you know how back in the day, I don't know, like when I went to university 20 years ago, it was always striving to be the best. You're always striving to be the best in your profession, learn as much as you can, get engaged in studies and so on, and go to your lectures, do additional reading and so on. Nowadays, it seems like it's a race to the bottom. Like it's a race from universities to get as many students as they can into the universities, give them the least amount of work possible, and then just give them a piece of paper to make it as easy and streamlined for the student, right? Is that what your experiences are with your studies?
Yeah, to be honest, I found exactly the same, because I studied when I was probably in my early 20s, maybe 21, 22. And it was very competitive, you couldn't ask for help from one of your classmates, because they'd be like, oh, is he trying to steal my ideas? Because this was the day before AI, it was, now it's, you go into class and I see 18-year-olds and they're there and they're fresh out of high school and they full don't want to fucking be there. And you're just thinking, I'm like, if you leave here, you have no professional experience, you have no work experience, you're just going to sit at home and mooch off your parents. What are you going to do? You're not contributing to society in your own way, so I see it.
So you definitely feel like, it's just like they're there just to waste time, would you say? I think in a sense, I've got a degree.
Yeah. Oh man, I think this is a really broad conversation. I don't exactly know what it is. Yeah. But I know that, and you know what? I don't know if it's universities as a whole or whether it's me as an educator or some of the other educators. I think we just really struggle to engage. I'll keep using the words engage.
Yep.
Really struggle to connect with the audience. And the audience, like you pointed out, is 20-year-olds, 18, 20-year-olds who have come from high school where they've been mostly babysat through high school and through primary school to, hey, sit down, sit up straight, don't play with your phone. But the whole education side of things hasn't really been taught to them. They've been spoon-fed the information.
Everything's easy.
For this question, you got to do it this way. They really haven't been exploring that problem-solving ability or lateral thinking ability, and as a result, they come to university and they just expect that that's what's going to happen from, for the next 3 or 4 or 5 years that they're at university, where someone's going to be like, hey, you know what? You need to know this, learn this, rope learn it. And I think university is not like TAFE, right? I've never studied a TAFE. I imagine TAFE is, do this, like this, I'm going to tick you off, tick.
Yeah, TAFE is very laid back, but we both went to TAFE, and I feel like what we liked more about TAFE than high school, because we did our VCEs there, was they treated you like an adult, and they weren't dictating to you. If you weren't going to come to class, the teacher's not going to bother. They're going to treat you as an adult, they're not going to spoon feed you, they're not going to, and we went at a young age. We were there, 15, 16 years old, and it was a completely different shock from high school, and I've got to say, just for the sake of saying it, I believe the education system here, as in for primary and secondary completely needs to be refined. They teach you such impractical stuff, It's,
but university is exactly like that. I treat all my patients, treat all my students like adults, and I literally say, you're an adult, you have a choice to be here. If you don't want to be here, go. I don't care. Yeah. But they still choose to be there, and they still choose to disrupt the class and talk in the background and not listen. And they still choose to not partake in the activities that I set out for them, like the practical stuff. And I'm thinking, mate, I didn't ask you to be here. You want to be here. If you don't want to be here, then go. Yeah. But if you want to be here, then partake in the activities, as in do the practical
Yeah.
work, get to know your peers, get
Do
to
the
know the
readings,
work,
listen
do the
to the
readings,
lectures,
listen
yeah.
to the lectures, but they don't even want to do that. So it's like, why are you here?
And what people forget is uni is fucking expensive. Sorry to swear, it's
It
fucking
is.
expensive,
It
man.
is.
You pay a
Absolutely.
lot of money, man,
Yeah.
to get that degree. So you're just wasting your own time in the future because you're going to have to fucking pay it off, you know? Like, it's... yeah.
Everything's become spoon-fed.
Yeah.
A lot of students are getting away with a lot of stuff when, if you go back in time, it was hard work, man. You had to study. There was no internet. There was no references, no chat. It was
Yeah.
hard work. You had to open the book and you had to study
Yeah.
and put in the hours. Now it's a bit easier. Like,
And, you know, it also does have to do with a lot of university. Here we go. This is probably controversial again. But with a lot of university policies in the sense that you can't make students do a lot of work. So we can only...
Really?
I know, right. Don't
Oh
ever
my
get me
God.
started. They have to have 4 assessment tasks per semester. So what you're thinking is you're going, I'm teaching you for 12 weeks and I can only do 4 assessment pieces per semester.
Oh, yeah, I have noticed that. 2
Yeah,
quizzes,
right.
2 essays. Yeah, that's a
and
thing.
then and a final assessment
Yeah.
piece at the end. And then you're thinking, hang on, so if I'm only assessing 4 assessment tasks, that's about 25% of the course that I can assess. There's no assessment task that captures everything.
Yeah, I didn't really think of it like that, you know? Like, you essentially, for like what I'm studying now, you have 1 quiz for like weeks 1 to 3, and then weeks 3 to like 6 or 3 to 7, you'll have like an essay.
Yeah,
and then it'll be reversed at the end of the year.
Yeah, that's
you
right.
know?
And
that's it.
you know, 20 questions in the quiz, right?
Oh, look, the questions, I hope my teachers don't think, straight ChatGPT, man.
Yeah,
Just
don't worry,
think that
I know
they're
it.
easy.
I know. That's
Yeah.
why I make my students do the quiz in class.
Oh, Boris is onto him. He's clever.
Because I know what you guys do.
Yeah, because like the essays, look, you do have to critically think, and like I have noticed, like obviously you ask ChatGPT for help and advice and ask me about essay structure. It's full robotic, man. There is no real way of getting about it.
Yeah.
If you have to demonstrate critical thinking, you can't get a computer to do it for you. You know,
No,
you have
no,
to do it yourself. But the quizzes,
Man,
it's different.
I get the quiz. There's a difference. Like, you know, essays, it is all about critical thinking, whereas the quiz is just supposed to test your general knowledge of a topic. So you can't do critical thinking in a quiz, right? If you think about it. But yeah, don't ever get me started about assessment pieces and
Random
and
question:
students.
have any of your students come to your practice?
Yeah,
Oh wow!
I've had 2.
By coincidence, or that you like they asked you and you said come past it? Like
No, it was just by coincidence. I think they needed a treatment. They looked me up and then came down for a treatment. It doesn't happen often. I don't encourage it.
leave Boris alone.
Yeah, I don't have time. I'm looking after you guys most of the time.
Do you still
guys
go
are hard
weekly
work.
to
What's that?
Boris? Do you still see Boris
Yeah,
weekly?
weekly.
How long has it been?
4 years now.
Wow.
Yeah, yeah.
Wow.
You sure it hasn't been longer? I feel like it's been longer.
I think it was pre-COVID, man.
Oh, yeah,
it was pre-COVID.
2019.
Yeah.
So it's been 5 years. Yeah, it's 5 or 6 years now.
Boris, was your practice counted as essential during the pandemic? Were you
Yeah, it
allowed
was.
to be operated? Like,
Oh,
yeah.
how did like that whole work? Like, just sanitize everything, make sure they wear masks and stuff, or
Yep, there you go.
you know, well, Boris.
Exactly, you nailed it. Make sure you wear masks. Make sure people check in, which is kind of stupid, right? Because
Yeah, you know where you are.
you
What's
know
the-
where you are. I've got a schedule. I know when you're coming in.
Yeah, no, it was an interesting time, COVID. It's
I remember when I used to go see him, with wear a mask, I would message you and I say, hey, make sure everything's wiped down and clean. And it was an interesting time. And it was
Yeah.
Did that affect your work or uni
Nah,
aspect
not at all. Nah, everything just pivoted. And don't you love that word, pivot? Like, it was such a popular word back in the pandemic
Yes.
days. Everything pivoted to online. Everything pivoted towards this.
How did you feel? How did you feel in the online studying? Did you feel like
You
it
know
was-
what? Honestly, I loved it more than being on
wow.
on campus. And I'll tell you why. I'll tell you why I like it. Because you can do my work. I know my stuff. I can teach what I need to teach. And then I log off and I'm done. Right? Don't have to do any practical work. Don't have to encourage students to do their work. Whereas now in the practical sense, like I said, you're in a prac class, you do your little spiel, you do your demonstration, you say, okay, guys, now go have a go at this for the next 10, 15 minutes. They just sit around,
one's done
have a chat.
nothing.
No one's done nothing.
Yeah.
And so I would much rather just be like all online. This is what you do. Log off, you're done. No prac work. Don't have to watch them or motivate them. Hey, you haven't done this. Have you tried doing it this way? None of that. It's just...
Well, with us, the online lectures, and I'm assuming that, like, because I study at La Trobe, I'm assuming that they know who's logging on and watching the lectures and
Oh
stuff.
yeah, man. I've got all the stats.
They ask questions in the lectures, so it will pause, and then it'll be like, for example, this, and that. What's the answer? And then, like, you have to answer it to proceed with the lecture. So lectures are engaging from home. Yeah,
our tech is in that high end. But you know what? Also, I respect that, and I go, yeah, that's really good for students to be engaging with it, to make sure they're listening. But you know what? If I was a student, I would absolutely hate that.
Oh, it's a pain in the ass.
Because I'm diligent enough to do my studies. Why do I have to be, boxed in with all the people that don't do the studies and are lazy? I just want to rush through it and just like top up my knowledge.
Do you miss the uni days when you're studying your degree and stuff like that?
Mate,
because it was a different culture back then.
Not really, but I will tell you one thing is that I probably study more now than I ever did at university.
Wow.
And it's because you have to be at the top of your game, right? You have to appreciate that. You got to be ahead. You have to know everything. You got to be prepared for any weird, dumbass question that a student's going to throw at you. So I'm sitting there before lectures or before prac classes, I'm like reading my textbook, making sure I got all the right dates, all the right stats.
A lot of pressure.
Yeah, it's a heap of pressure, right? I've got my little notebook, and then when I'm in the class, you got to look professional. You got to look like you know what you're talking about. There's no room for error. There's no interpretation. And because the students look up to you, right? Well, I like to think they do.
Well, Boris, we look up to you.
That's all that matters.
We look up to you and the community looks up to you.
You got to have the right information. You got to just be on top of it. As soon as they ask you a question, you got to be like, yeah, bang, it's this. So
interesting, very interesting.
And sometimes I feel like I'm writing a textbook every week. But anyway, that's a different story.
So you've written in a journal, haven't you? Because like for your masters, are you required to? No,
it was masters by coursework.
Okay. Oh, perfect then. So it's just easy. A good 2 years. Well, I wouldn't say easy, but yeah.
It was
Breeze
pretty,
is 2 years,
pretty crazy.
Yeah, that's it. RMIT, yeah, you studied that.
Yep.
Yeah. So what, Boris? How old are you now?
43.
And what, you started university at 18? I'm guessing straight out of high school. Did you take a gap year or anything like that?
No, I did. I started engineering. I started electrical engineering at 18.
I did not know that.
Yeah, right.
Wow.
I did 3 years of it, and I was just like, I suck at this. I'm never going to get a job in this. You know what it was?
Wow.
It was, you're at university and you're with all these nerds, right? There's nothing wrong with nerds.
No.
But right, so I would go to university on a Monday and I'd be like, oh boys, how was the weekend? What'd you get up to? And I'd be like out partying, just going clubbing and stuff, going out drinking with the guys. And then they'd be like, oh, I was sitting at home and I actually built a computer. I did the semiconductor thing.
Boris, you do good impressions, man. I'm learning everything about you today, man.
I was like, what? Why would you have party, man? You're 18. And they're like, oh no, I'm just doing some computer work. I wrote a program. I was like, mate, you're missing out. You're missing out on socializing.
My parents would have killed me if I studied 3 years of an engineering degree and then decided I wanted to change.
Oh, you know what? I asked my dad for permission. I was like, oh, my dad, I actually don't like engineering. Can I quit? He's like, about bloody time. Because you sucked at it.
That's very interesting. I was talking to my sister because obviously she's studying to be an osteo, and she
great profession.
Great profession. So she said something very interesting, and it surprises me that you learn from everyone, even young kids, adults, children, everything. She said that when you're studying an osteo and you complete you become an osteo, you don't stop learning. Apparently, you keep doing
So you got to do your
studies.
You got to keep up with professional development plans.
Yeah, how crazy is that?
Yeah.
So you don't it never ends for you.
No, it doesn't. And this is all for those kind of professional jobs, right? Because what happens in the real world, like when you finish university, it's not like your mind's closed shut, like you know everything. The whole medical field, allied health field, even engineering, any of those fields,
it's evolving.
They evolve.
Yeah.
So you got to stay up to date with the latest research, latest content, latest ways of doing things. But see, I do have a fundamental problem with this. I got a lot of opinions on a lot of things. This is just one sort of opinion.
Give me the
goss. So I hate this like bias that most people have, right? And so when you finish university, so you're at university, you're forced to do all these subjects that you don't like, some you do like, and you're forced to engage in those and learn about them, right? What happens when you finish university? You go, screw that content. I don't like doing that. I'm just going to do continuous education on the content I like. And so you become really biased within that. And so my issue with that is within osteopathy, that's the reason why I absolutely love osteopathy, is such a diverse way of treating. So you can go in any different area, right? You can treat in sports, you can treat in pediatrics, you can do more rehab stuff, you can just do hands-on stuff. There's different modalities of manual therapy that you can utilize, right? Some of these modalities have a lot of evidence to support their utilization. Some of these or others don't. Yeah. And so if you get seduced by some of these other lesser effective modalities with limited evidence to it, then you kind of go down that pathway, and then you kind of drink that Kool-Aid where you sort of suddenly think that what you're doing is amazing work, which is also then confirmation bias, and it's also very biased based on what you observe with your patients, right? And you can have this like placebo effect that happens when you're treating those patients. So you go down that pathway, which is less evidence informed, less evidence to support its efficacy, but yet you still engage in it, and you still do those continuous education.
I never thought of it like that, that even in professional practice you can carry biases on.
Absolutely.
You know, that's very interesting. And like you would assume biases would be like just as soon as you hear it like a political bias or a cultural bias, but you'd never think of it in a professional setting. You know, and the way you said carrying on biases, and you know, and then your practice could evolve into bad practice, hypothetically. You know, that's interesting.
Absolutely. So, yeah, I mean,
I never thought of it like that. You know, I think everyone's just always got to evolve constantly. You know, you've got to be dynamic, but see, the risk is what information are you taking in and what information are you processing. You know, you need to make sure that what you're taking in is the right stuff.
Yes.
You know,
well, that's why at university we only teach evidence-based practice.
Yeah.
And so when you leave that profession, you can title yourself as an osteo, physio, chiro, whatever you want, but it doesn't necessarily mean that you're up to date with the latest evidence. Like, look at the medical profession, right? In the 1800s, you were doing bloodletting and putting leeches on wounds and doing all this other crazy stuff, right? Yeah. And now it's evolved where you're actually doing properly surgery on very minute things using robotics and that, right? And even the surgical techniques have changed. Right, so usually with, you know, back in 20 years ago or whatever it was, you do hip replacements, you'd be basically cutting all the way through the glutes. Yeah. Now the surgical techniques have even changed, so it's causing less damage to the tissues and you're getting better recoveries. So imagine if you were doing CPD points on the old techniques, thinking that, you know, bloodletting and cutting off limbs, and you wouldn't be effective today. You'd be doing people a disservice. Right, and I kind of feel that that's some concept of that is actually happening within my profession, where people have been led down a path, and sorry for people that are listening to this that feel otherwise about certain type of treatment techniques, but they're led down a path and they're sort of seduced by the charismatic practitioner, the person that is going to fix them, but that's not what the evidence says, right? It's probably more a placebo effect.
Ahmed was doing the settings there. I don't know if the camera picked that up. I've never asked you. I remember Boris was asking you about like before. Bro, what is the go with the vapor machine?
He wants the mist.
I want the mist. So apparently there's like a mist. You put these, you know, these drops in there and it makes you feel relaxed, and it doesn't work though.
I'm relaxed, but I just thought that was good company. Yeah, that's what I was. You know, we got Boris here, we got Ahmed.
Boris is like I'm telling you, ladies and gentlemen, if you don't know, like I say, Boris is king. He's leading communities to victory.
You're giving me way too much credit.
I have a question. What led you to become what you want to do in osteo?
Yeah, from
always
engineering to thing.
Yeah, that's a big jump, Boris.
Switch, man.
Well, believe it or not, I actually wanted to do chiro at the start.
Oh. Wow.
Yeah, you're like, lines. I want to be a chiro, right? But no, it only really came from because I was working in the gym. There was a really good chiro student that was working with us. He had all these great stories. And this is probably where my love of stories sort of came from, right? Is talking to him, he was a Canadian guy, Dean, if he's listening. He had a story for everything. So you'd be like, oh yeah, what did you used to do in your past? It was like, oh, do you know I used to be a carpenter back in Canada? I was working in Alaska and shit like that. I was like, really? Like, that's pretty mad. And then you talk to him the next day, he's like, yeah, you know what, I used to be a baggage handler in Canada. And I was like, really?
Do you know you were just saying, and I just thought of it now. Do you know the way like capitalism has kind of like, and I know I'm delving deep here, but it's turned people into robots. And we're constantly, like, think of a baggage handler, yeah? He's doing one repetitive movement constantly, you
That's
know?
always been the case, though.
Like, has it, like, but, like, you have to think about, like, factory workers.
Yeah.
You know? Like, stuff like that. It's always just, like, a very streamlined approach now. Just, like, even the way we take, like, manual labor, you know?
True.
It's just, yeah, do. And, yeah.
But that's all society, right? You got to make money somehow.
Yeah, well, that is a good point.
That's very interesting. I've got another one for you, Boris, here.
Yeah, good.
Boris is like, this guy's what do you see in people's bodies that they often ignore? Every time they come in, what are they ignoring? What are you looking at and you're seeing?
Most of the people just ignore their general aches and pains before they actually need to come see them. So if you come see us before things get terrible, then it's obviously going to be a lot better, right? But no, especially with men, they leave things for like 3-4 months. And then you're like, mate, I could have fixed this, or I could have helped you with this within 1 or 2 treatments. Now I have to see you for the next 3 months. Like, just get it done sooner, so that way you don't have to be dealing with it for that long.
What's the most common injuries that people come in with?
That's a good one.
Male and then female.
So females usually headaches and neck issues.
Yeah.
Men usually lower back issues. And it's probably just the different sorts of work that most men and females do, and also the fact that maybe women stress a little bit more than men.
Really?
So all that tension comes in through the neck.
Well,
Their cervicogenic sort of headaches.
to be honest, yeah, I would have thought, like, you know, if I was getting like recurring headaches, I would have seen a GP. You know, I would not have thought an osteo.
I went to him
100%.
when I had
For
headache.
headaches,
and it
wow.
was interesting. Yeah, he done all these weird needles on the top, and I felt like I was flying, man. My head was just felt different. I don't know what it was, the pressure. But I felt the headache went.
Do you know with the needles? Does that come from like Chinese medicine?
Yep, sure does.
And like
with Chinese medicine, it's different, right? So in the allied health, physio, osteo, and chiro world, we say dry needling, because it's basically a needle that's dry. Like, you're not injecting anything into the body. Basically, with Chinese medicine and acupuncture, they use the same equipment, but the points they utilize are different, right? So in Chinese medicine, they have these like proper points that they, you know, I don't actually know what they call it, spleen 2, spleen 5, or whatever it is, right? And it's supposed to release energy flow, chi flow throughout the body or whatever. So
Activate
they'll be
the
like
chakras.
putting needles in your, and sorry, Chinese medicine people out there. And like, I think you guys are valuable, but I don't think it works for me. But they'll stick needles in your toes and in your feet because they want to release chi.
Yeah.
in
Frank
your
likes all the foot stuff, so here you go, Frank.
Oh, you got a bit of
But
a
no,
foot
to be honest, foot massage I love.
Oh, okay.
I was always been telling him, I'm like, your body stress is built up in your feet, so get a foot massage when you sit. Is that true?
Frank, is that true?
That's like reflexology.
That's a
stuff,
myth, man. That's a myth.
Is that a myth?
Nah.
Yeah.
I would say, no, man. I would say that a lot of people's stress is either in the neck or shoulders or in through the glutes.
Yeah.
The glutes.
Yeah.
Wow. Yeah.
Yeah, it can either go either way.
Because Frankie comes up to me, he's just like always, he's like, you need to get a foot massage, man. He releases the mind. It's like,
What?
He doesn't, man.
Nah, not releases the mind. It releases stress.
Yeah.
Because I get mellowed out, man. When I get a foot massage, man, I just get like. Do you know with the Thai style where they
Maybe
get
I
like
think
that
you
hot
just like
stick?
massages.
I love massages.
There you go. That's what it is.
Yeah.
Well, that's our rabbit
Just
hole.
like that
we best
physical
not go down on.
He loves it. Boris, I've got another very interesting one for you. If we sit too much, what's one movement we should do on a day-to-day basis?
Just stand up, do a squat.
Just a squat.
Just a squat.
Wow.
So a really good thing that I've read about is you just have a kettlebell next to your bed, or next to your bed. What would you have one of those next to your bed? So you just have a kettlebell next to your desk. Every 20 minutes, just do 10 reps. 10 kettlebell swings, boom, you're done. Sit back down, 20 minutes.
Every 20 minutes.
Yeah.
Wow. Whatever.
Do 10 reps.
Sit-ups.
Push-ups, sit-ups, yeah, anything. That's
Every
good.
20 minutes.
Yep.
How many of them do you do, Frank?
Bro, I don't
0.
exercise, man. Yeah, my exercise game. To be honest, I'll be like, I get very lazy, man, when it comes to exercise. I don't know what it is. It's just never been for me. Like, I try to go to the gym, like, even homework and stuff like that, like in a physical sense, even if it's my own well-being, I slack off on it, man. I don't understand what
Like
it
I
is.
said
but
at the top of this,
yeah, it's
humans
just.
are lazy. We're lazy people. We go for comfort over doing hard work. But you know yourself, right? You go, or maybe you know yourself, you go, I have to go for a run, I have to do a workout. It's hard getting there.
Yep.
You have to push yourself. It's something inside where you're just driven to go there. and it's hard work. And then you get there and you start, and you're like, actually,
I
this
saw
is
what
pretty
you
good.
last time.
I'm going
It's
to get
like
crazy.
The last episode, and he's just like, I don't have that motivation ever. Frankie never has the motivation for training, but I can't live without it. See how everyone's got this different mentality where
everyone's got a different reason for doing it, right? So you do it for your reasons.
Yep.
Frankie doesn't do it for his reasons.
We haven't discovered them yet, but yeah.
His reasons.
health is wealth, though. So
Health is wealth. There you go. That's good. Yeah, 100%.
I'm telling you, Frankie, it's
Motions, lotions, health is wealth.
A lot of wisdom
Rest is
here.
rust.
A lot of wisdom.
what's a common body issue you see all the time that's easily preventable?
Headaches, neck tension. Just chill a bit more. Do some yoga. Do some upward dog, downward
So
dog.
what's with this yoga, man? Come on,
Man,
tell me.
come-
Does it work or?
Nah, man. Like,
Let's be real. Tell
it
me
does
about
work.
yoga.
No, it really depends on what you want. So I have this philosophy. Maybe it's not a philosophy. Maybe I read it somewhere. I don't know. I'm going to claim it as my own, though.
Yeah.
It's like there is no bad exercise. There's no bad activity. It just depends on the goal of that
Wow,
activity or
I
what
never
you want. What you want
I
to
never
try,
thought
right?
of that. That's
so if you want to
very
do deadlift,
Yep.
that's great. And
Yeah.
it gives you that nice hip hinge. You're
Yeah.
working through those back muscles. That's great, right? If you want to do yoga, well, why would you do yoga? It's great for mind-body connection. It's, good to sit at the end of at the back of the class, watch the class unfold.
Because I know Pilates is legit, man. Like
Pilates
people
is
who
a
do
workout,
Pilates,
yeah.
they're jacked, man. Like it's all core strength.
Yeah.
Pilates is legit, man.
So yeah, it really depends. So Pilates is good for and has its own philosophy around it and why it's good. Yoga's got its own. Gym again has got its own little philosophy. It really just depends on what you want to get out of it, right? You're not going to give an 80-year-old lady with arthritic wrists to get her to do boxing, right?
Oh yeah,
Right.
definitely.
You know what I mean?
Yeah.
But then again, if you have someone who wants to let off aggression and
Send 'em off to
do some boxing,
Yeah.
right?
Yeah.
And it doesn't mean that they want to punch someone else out or, do a KO or whatever. It just means they want to let off some aggression. Or if they don't like that, go get them to do MMA or something.
Boris, I
what I
was just
mean?
thinking about it before. So there's the Greek guy, Hippocrates or whatever, the father of modern medicine. But he's more of like a pharmaceutical and like health and well-being
Yeah,
surgery
yeah.
medicine. Where does like therapeutic massage medicine originate from? From Greece as well? Like who's like the founder of all this stuff?
I
Like,
don't
I know
know,
it's like
man,
a long
that's
shoot,
deep.
but
That's
would you
deep.
say it's like
That's-
China? Like China,
China.
like, yeah, because like the whole Chinese massage thing. I don't know, man. I don't
What
know.
about Thai massage then?
Yeah, Thai
Could we go
massage
some
as well.
Thai?
Yeah, good, possible. Like an East
Well,
Asian
honestly,
thing.
I don't know. I couldn't even answer that question because I've never really looked into it. But it's a really interesting question.
Well, for the
I
next
wonder-
time,
Yeah.
Boris is on.
Because Frankie comes up to me and he's like, there's Thai massage, there's this massage, and he's having all these massages and they're all different.
Yeah.
I never knew
Yeah,
that.
they're all, yeah.
Everyone does massages in a different way.
They all kind of end the same.
Yes, some people I know like people jumping on their backs and stomping on them. I'm just like, I don't know what massage that is, but you know what I
Yeah.
mean? Some people like stones, hot apparently. There's the hot stones. Have you ever had that, Frankie?
Yeah, the hot stones, yeah. I don't get what the go with that is, but like it works, it relaxes you, but I don't get like how it kind of, just the heat does it or, yeah. I
Well,
don't
what's your
know.
opinion on that, Boris?
No, look, it's all good stuff. Like I keep saying, physical touch is good, massage is good, whatever works for you, keep doing it, right? Unless you got a specific pathology or a specific condition that you need managed. So yeah, go for it. But while you were talking, I had a thought. Whereas I was reading a study once, this is years ago, and what they were saying is that the reason why manual therapy works is because if you think about it, like go really deep, it reminds you of your mother's soothing touch when you were a kid to being comforted, just that touch and that
Wow.
soothing
Wow.
physical connection.
Wow.
And so
Very
then as you
interesting.
get older, still the same thing occurs. Whether that's true or not, I don't know. It
And
just
is that
sounds
why
very
men
romantic.
kind of tend to lean more of like a female giving them a massage? That's what I see.
I don't know.
You know, how many people do I know that want a man to massage them? It's always women.
I think that's a bit of a different conversation, but look, honestly, I don't know.
Maybe.
But, it's interesting enough, though, even though you make that sort of comment, it really depends on what kind of massage you're after. Because I know that I see a lot of male patients that come see me because I can be more physical, because I can actually go a little bit deeper
Strength.
and have more strength to
Yeah.
apply those techniques as opposed to a female practitioner. So, it's a bit of personal preference, really, at the end of the day.
I've got to say, Boris, but you are jacked, man. Like, I don't know if the camera can tell. Like,
Nah,
you've got
man.
good size on your head.
Not as much as you guys.
You're both pretty jacked, man.
No, but I believe that's all fine. Like when I give him a handshake, sometimes you can see the strength in. It's definitely from
Oh, yeah, man.
massaging.
Look at these muscles.
Imagine giving a slap to someone with that hand or a backhand or something.
Look, what's yours like?
No,
You got to go like that. Push your thumbs together. Oh, that's actually not. Oh, that's
Nah,
feel
it's
that
weak.
solid.
Yeah, no, that looks rock
stone.
solid, man.
Solid hand muscles.
It's a stone. How do you balance life, Boris? Because you're a teacher, in the
I
army,
think-
you work. How are you balancing all that? I always talk to Frankie.
It
about
really depends. Like, honestly, I get this question a fair bit. Like, how do you balance everything? I think balance comes with what you want to do, right? So I don't do anything I don't want to do. So
It's all a passion in a sense. Yeah,
exactly. So if I don't want to see patients, I'll just say, no, I'm busy. I don't want to see you. I'm going to finish early, like tonight.
Yeah,
Yeah,
definitely.
it's a good perspective that if you do something that you love, you're not really working. You're just following your dreams.
I think
like
a lot of
passions.
people that talk about that work-life balance side of things is that, I mean, this could be controversial again, but they probably just really haven't found something they like doing, right? So they just work to live, as opposed to what I probably do a little bit too much is live to work.
Yeah.
But I actually enjoy doing what I work, and I don't miss out on anything I don't want to do, right? So I still go to the gym, I still go for a run, still treat patients, still go out for dinners and do social activities, do podcasts, whatever.
Because
You know,
it
and still
is
teach.
a busy life. We can't disagree.
Yeah.
And I always sit down with Frankie and we just say it's I don't know much people that have that kind of lifestyle and keep up with it. Seeing patients, being social, working, army, it's crazy busy.
Yeah, yeah.
And I just find it very fascinating that you keep it all under control and you're cool about it. Like I've never asked you I'm stressing on my head. And it's just you're always cool. Like, yeah, man, cool. Man.
There's no point whinging about it. If you don't want to do it, don't do it.
He's added podcasts in it too now, so now he's a podcaster as well.
Yeah,
So another notch in the belt.
Damn.
What's one thing you wish every client knew before coming to you?
Well, I thought about this question before.
Yes, it was coming.
It was coming. It was coming. I think they just need to know that you got to do some homework. I'm not going to fix them. I'm not going to do any magical thing that's going to actually help. Well, yes, I can do magical things that will help them out, but really they have to do the work on themselves. So it's not.
You're kind of like a wizard sometimes.
I'm not a wizard, man. Come on. No. It's really just about that thinking that I'm not going to do the work for them. They have to do the work for themselves.
Yeah,
And
yeah,
fix
definitely.
themselves at the end of the
Do
day.
you get a lot of whinging clients sometimes?
Man, all the time. All my clients are whinging, right? Because you know what it is? I think it's whinging, but for them, and I try and pretend like haven't heard this before, but for them, this is the first time they've told their story to someone else about their pain. For me,
Wow.
this is the 100th and millionth time I've heard the exact same story play out, just with a different character, right? So when they say, oh, my back hurts, and they're trying to explain where it is, sometimes I'm like, this is important for them to convey the message, but I already know what's going on, right? And it's so cathartic when you tell someone your problems, it kind of feels like they've gone away.
Yeah,
notice that?
100%. When you get it off your shoulders, and you said something interesting there. Like when someone shares their pain with you, like that in itself is therapeutic. You know?
100%. It's kind of they feel like they're sharing that burden, and it's important that you listen to them rather than cut them off and be like, "Yep, I know what's going on." They jump on the table. You got to kind of let them finish that story, and sometimes I just let them run while I'm like just switched off, thinking about something else, writing some notes, and then I'm like, yeah, and they're like waffling on. I'm like, okay. Put on a gown, let's go, let's do some assessments.
Very interesting. It's just like the whole concept of it, it's repetitive, like we were talking about it before. Does it ever get to you? Like the constant...
All the time. You know what it is? Like I said, I like problem solving. I like sort of getting down into understanding where people are coming from. Once you know that and you're just doing the nitty gritty, like doing the manipulation, doing the massage, that kills me.
Really?
That kills me. Sometimes. Unless you've got good conversation that goes with the whole consult. So if, let's say, like, when we interact, we have some great conversation. So that time just, bang, it's a breeze. You just through that sort of time frame real quick. But when you have some patients that are a little bit older, that, English is their second language, you just don't have that conversation. You're just going through the motions. You're like, man, 30 more minutes, 15 more minutes. Is it over yet?
Because I've used your online booking thing as well. And Boris, you're open crazy hours, man. You're open from like 8 to 8, aren't you? Like what hours do you work?
Usually I have my diary open from 6 to like 9.
Wow.
But not anyone uses like 6 a.m. Most people come in at 7:30 respectful time. Look, I just like to give people options. Maybe I was more driven by the money back in the day when I first started and opened up your business, as you really should. Like, you got to earn a living, you got to eat, you got to develop it. But now I just sort of leave it open for convenience. And most of the time I'll be like, tomorrow I don't want to get up that early. I'll just block off that time frame. Or you just call up a patient and books at 6 and you go, hey, did you make a mistake? Did you really mean 6 p.m.?
If you've got to start work at 6, you've got to be up at like 4:35 or something. Like, I don't know how close you are to your work, but
I live like 5 minutes away.
Here's the
easy. I'm
Yeah.
half an hour, wake up, bang, jump in the shower, off you go. Oh no.
What's the most surprising thing the body has taught you over the years, Boris? Treating patients. What is
how
it?
adaptable it is and how easy it is to change.
Wow. Very interesting.
You're like, please elaborate on that.
Yeah, give me a bit more on that.
Definitely.
That's interesting. You know, because you obviously, how long you been in? Like,
12 years. Yeah, since 2012.
That's a long time. So you've seen a lot of body shapes, a lot of bodies.
So I think ultimately one thing that's really interesting about the human body is that's really adaptable. It can handle a fair bit of stress. And I really like this principle. It's called the SAID principle. So it's it adapts to specific adaptations to impose demand, right? So anything you impose on your body will adapt to it. And so this really speaks true for doing weight training, doing any sorts of training, cardiovascular training. It's going to adapt for that specific task, right? What you don't see is that also applies when you're sedentary and you're sitting down. So when you see all those crazy postures of people sitting down and they're all curved like a question mark and so on, their body's just adapting to their demand that's placed on it, right? What's really good about that is that because of that same principle, you can change all of that. It's very adaptable. It'll take a bit of time, but you can change it. And so you just really need to apply the right sort of training, treatment to be able to, fix someone's dysfunction or whatever. But then also, when you're doing manual therapy, it's really amazing when you get that right cavitation, or you get that right manipulation, or you put in some needles, or you poke the right muscles, that you get a really good outcome from it. Like you can feel the muscles melt away from your fingers, and you're like, yeah, that was a really good outcome. And then also, when the patient jumps off the treatment table, they're feeling a lot better, right? But based on that same principle, when they come back and they're going, oh yeah, it's back again. Well, what did you do in the meantime So obviously your body's adapting to your environment. So you have to change your environment.
I found it interesting when you said the body learns good habits and the body will learn bad habits. So if you're sitting, the body will adapt to that. That was very interesting. Like, you'd think that because you know how like your body's in like perpetual state of trying to always heal itself, even if it's not.
100%.
You would think that
homeostasis, always in that constant flux.
It's interesting, the way the body works, like...
Very fascinating point. Very fascinating. That it adapts to... It's like your brain. It adapts to bad or good thoughts. So if you wake up in the morning and you say to yourself, today's going to be a shit day, it's dark room, the curtains are closed, you're going to have a really bad day.
Yeah, absolutely. And you don't want to start your day off like that, to be honest.
At all. And all you need to do is just open the curtains, open the window.
And just have a positive outlook.
Have a positive outlook. Look at that, Bryce. Bryce, I reckon you should become like a philosophy, like some expert professor. I'm telling you, man.
There's no chance.
What do you reckon?
Boris has got wisdom, man. wisdom.
I'm telling you, imagine Boris being a professor.
Boris, would you ever open your own podcast or jump back on? I gotta say,
jump back on here.
Well, definitely, would love to have you again.
Come on.
We're gonna have a little chat. We'll have you and the other guest that's coming on the special one. And there'll be some interesting topics.
That'll be a really good conversation.
Oh yeah. That'll be very
after we'll go to dinner or something.
maybe I'll invite you guys onto my podcast.
Look at
the competition.
I love it, Boris. It's always an honour to have you on, and it's definitely. For me, it's been a learning journey, and I've been so grateful. I've learned a lot of positive stuff, and you've made my body heal in many aspects. I still have injuries that I'm healing from, and it's very interesting. What you can learn from people, socializing and having good charisma. You were teaching me last time about charisma, and That's what I'm working on
It's
now, is
important.
charisma.
You know what I love about
think you got
Boris is Boris is someone, and this is very hard to find in our day and age, that someone that you can listen to and you can talk to.
Yes.
And you can exchange information, whatever it may be. Everything's always like has a learning outcome with Boris. You know, like today we touched on a million topics: work-life balance, health, adaptability of the body, and there's always something interesting with talking to Boris. So it's a pleasure.
And that's
Definitely a
why
pleasure.
Frankie always tells me, he's like, "What do you go see Boris for some advice?" I'm just
Yeah,
like,
straight.
treatment
90%
or
of the time,
advice?
it's like I see, it's just the talk, Boris.
You know what I
I
mean?
need the gas.
The goss, everyone needs a bit of goss. Why do you feel like we need, as human beings, we love goss?
I don't know, man, but there has been a recent study a couple of days ago that explored that exact topic. I don't know. I don't know the.
It's interesting.
The
We
outcomes
all
of
love it.
Yeah, we do.
It's not just an ethnic thing as well.
Nah,
Like everyone
no.
likes gas.
I'm guilty of it today. I was talking on the phone to someone, and he's telling me about his productive day, but then he started talking about the bad stuff, and I was like, yeah, get to the bad stuff. I want to know the bad stuff. I don't care about the good stuff anymore. I need to know the bad stuff. It's very interesting, and I'd like to, ask.
Maybe we save this conversation for off camera.
Yeah.
It's the bad stuff. I want the gas
We want
too.
to get the goss from you guys.
But Boris, it was a pleasure.
It's a
No
pleasure.
problem. Pleasure's all mine.
Like I said, everyone, ladies and gentlemen, I appreciate you being on here.
No, thanks for the
This is
invite.
the man and only Boris Lukin. It's always an honour to be here talking with you, learning, and if you guys need treatment, this is the man. Beyond Fitness.
Beyond Fit,
Beyond
Uni
Fitness,
Ponds.
yeah.
Beyond Fitness.
Book online.
And
Your support.
if you need knowledge, you need philosophy, you need advice, you need wisdom, Boris Lukin. You need dating advice, Boris Lukin. You need medical.
Maybe we beep that one.
But it's an absolute pleasure.
No,
And it was
pleasure was
a-
all
it was a
mine.
good
It was
show.
good fun.
Thanks,
No,
Boris.
thanks for that.
Pleasant.